Public health history tends to be very male. The women don't often get a look in to the history of public health. But here in Liverpool, we have what my wife, a lecturer in adult education, calls Liverpool's significant sisters. And these were formidable women. We're talking here about Kitty Wilkinson, who came in from Ireland quite early on in the 1840s, and she established the first public wash houses, slipper baths, and places where poor people could go and do their laundry and have a bath. Agnes Jones, who worked with Florence Nightingale, to a blueprint established by Eleanor Rathbone and her husband William Rathbone, the Member of Parliament, to establish community nursing, taking women almost literally out of the gutter and making them into Nightingale nurses. There are many firsts that Liverpool can claim, but probably the most important landmark in the development of public health was Liverpool's role in appointing the first medical officer of health, not just in the country, but internationally, in the form of William Henry Duncan, who was a local boy, born in Seal Street in the centre of town. Duncan was interested in the population health as well as the individual health. The situation in Liverpool around 1800 was that the place was growing really fast. Population 1800 is about 130,000. 30 years later, it was 300,000. The merchants started off down by their warehouses by the docks, but they were moving further and further away to get away from the hoi polloi of the masses. As merchants evacuated their houses, they built court housing in the back gardens and the yards as speculative building, so that we find when Duncan was surveying the population, he found these incredible population densities in the court housing. The conditions were such that when the cholera turned up in Liverpool at the end of 1847, it took off like wildfire in these kind of environments. By the time he died, quite early in his 50s, he was a power in the Commonwealth. He gave lectures on poverty and inequality. He was first secretary of the Liverpool Medical Institution. So, you know, this man was a major figure in Liverpool. He'd really had an impact